So over to Sir Dr. Vinod Kumar sir for your comments, and I would like to know, and the audience as well. So what could be the provisions for addressing these issues to reduce that gap of 1 decade, as I mentioned? Yes, yes, sir.
Firstly, my grateful thanks to Team IPU for making me a part of this mega event. Living not only longer but also better is the cherished dream of humankind. Is it on slideshow? Yes, correct. So, I think most people realize the complexities of giving care to elderly people. Starting from the caregiving strategies, you would probably agree with me that the geriatric population is requiring the maximum number of settings of care, beginning with self caring, home caring, hospital caring, day caring, or end of life caring, hospice caring, palliative caring, caring in old age home, caring through rehabilitation, and so many other settings. So they are requiring care all over the various care settings. Secondly, healthy aging practices for living longer and living better are a lifelong process and not just at the time when one is stepping into old age. Thirdly, one of the problems with which the elderly people are to reckon with is the very costly treatment in the form of hospitalization, in the form of medication, and also in the form of costly insurance products, although they are the cheapest in our country. And also they are subjected to a very many unnecessary investigation which also costs money. So there is an issue about health economics for the elderly people. Fourthly, there is some kind of a societal discrimination, sometimes amounting to neglect against the elderly people across the world, not only in India but across the world. And also, there is a phenomenon called geriatricism, which is a dangerous institutional and professional aversion to caring the elderly people because it is not a very respectable and money making specialty. So I think there is a need to prepare trained geriatricians as we have wonderful specialists from other across the discipline. Then the last two I am going to briefly discuss here because they are concerned with living better and also they are important for creating an ecosystem for geriatric care across the country which is easily understandable and easily deliverable. This is the called 5 M's of geriatrics. This is a communication system through which geriatricians would like to disseminate the complexities and the priority areas which should be addressed in the geriatric care. I might like to add here that this communication system of geriatric care is not only concerning geriatricians, but we are always requesting the other wonderful specialties to adopt this system because most of their patients across various specialties are elderly people. So this is not only a domain of geriatricians, it is a domain of all the specialties. And to make this as a summary version, most important thing matters most. Matters most, I mean to say that we have to find out what are the aspirations and goals of the elderly people when he comes under your treatment. For him, intervention is not that important, rather, independence is important. He has more importance to his functional independence rather than cure. He also wants to have the independent thinking about his future goals. He should be managed to find out what are his aspirations for things like advanced planning. Otherwise, if you delay it and when they lose their cognition and other facilities, then it is too late and their wishful aspirations may never be honored. So, living will, advanced planning, all that comes under the matters most. Then, mind. I think it is equally important for all the elderly people, whether they are with disease or without disease, they have to remain cognitively alert. That will prevent from occurring dementia and depression. Then mobility is very important. Many people are finding hard to walk properly. They may lose balance and they sometimes injure themselves and get fractures. Fourth, but not the least important, the medication. I think elderly people, because they are suffering from a number of morbidities, so they go to different specialists and they get medicine prescriptions from each one of them, sometimes duplicating, sometimes having drug interactions, adverse effects, and so on. So this polypharmacy has to be kept in mind in every specialty. Then multi-complexity. Multi-complexity means a elderly patient has to have most of the time multi-morbidity. He has more than one disease. He often has diabetes, hypertension, and many other diseases sometimes. And this together with his financial status, his social status is dwindling down. These are adding to his physical morbidity also. So they also have to be kept in mind. So these 5 M's are important across all the specialties as far as the elder individuals are concerned, and we recommend this as a part of ecosystem for geriatric care as a whole. And I think all governments of the state and center, all the NGOs, all the healthcare providers should adopt this approach. There are intricacies for which we have no time, but they are all manageable to the best possible extent. That was as far as the system-based policies are concerned. Now I have this last slide about the individual-based policies. This particular slide was devised few years before, which I call as 10 commandments of healthy aging. This should be adopted as a part of policy to shoulder the responsibility on the aging individual himself. And I am very happy to note that some of the organizations, including Inspiring Foundation, Inspiring Senior Foundation, and very recently in 2025, in a document of 88 pages, subject on graceful and active aging, unlocking the secrets of longevity, this has been incorporated in that document. So these are very simple things to practice. And this is, for example, eat proper, exercise well, enrich socially, remain mentally alert, engage spirituality, and have an annual health checkup on every annual birthday, have a good and full sleep, and observe personal cleanliness and pollution, that is environment, both outdoor and indoor pollution. And finally, I have watermarked 2 more things. One is happiness and contentment, other is positive thinking, and what is called mild stress. Facing mild stress is useful for health and longevity. I am not for the moment telling that chronic severe stress is something which is not at all to be welcomed, because that shortens the life. But in the same breath, I am telling mild, intermittent these stresses, when you get daily, these stresses may be physical, maybe nutritional, maybe psychological, maybe emotional, sometimes spiritual also. These stresses, they trigger your cells to prepare for the larger stress. And in the process, these cells over time work. They remove the debris of what has happened in the earlier stresses, and they overcompensate and delay the aging process. We will talk about it someday later. There is a science behind this, and there is also a science behind happiness and contentment, because many medical experts would probably regard these two things as abstract advantages, but there is a science behind it, and all other that I have named, there is unmistakable scientific evidence both from the modern science as well as the ancient science to support this. So these 10 commandments of aging should also be adopted as a policy and wide across the country, both in the rural and urban landscape. This has to be promoted. So rest of the things I would talk some other day, but I think the question that has been posed, this is what I could summarize in these 4 slides. Thank you very much.
Thank you, sir.